Most people, even most doctors, know very little about mitochondrial diseases. They affect millions of people, especially children, with devastating consequences. In fact, more kids suffer from mitochondrial diseases than all childhood cancers combined. But a new and more sensitive test is now available to diagnose this disease in kids, potentially saving their lives. 3-year-old Gwynnie Andrews looks like a normal, healthy little girl. But her mom, Beth, says as soon as she was born, she knew something was wrong. In this baby picture, you can see Gwynnie's right eye is drooping, which should have been a sign for doctors to run some tests, but they didn't. And for the next 3 years of her life, she would be in and out of hospitals with violent cases of vomiting and dehydration.
Going to the emergency room 4 times in 3 months is not normal.
But doctors kept sending her home, saying Gwynnie just had the flu or a common cold. One night, Gwynnie was so sick she was near death as she entered yet another ER.
Hours away from organ failure, she was in metabolic decompensation with a blood sugar of 37 when we came to the Children's Hospital Los Angeles emergency room.
When Beth finally brought Gwynnie here to Children's Hospital Los Angeles, she was finally able to learn what was wrong with her little girl. Dr. Richard Bowles examined Gwynnie and diagnosed her with mitochondrial disease, which means her cells do not make enough energy. He used a new genetic test, the Medomix MitoDX, developed by clinical geneticist Dr. Steve Sommer. The test allowed him to do what countless other doctors could not: accurately diagnose this little girl who was suffering needlessly.
Mitochondrial disease can look like almost anything. It can masquerade as lots of problems. It can look like autism, it can look like seizure disorders, sudden death, migraine headaches, depression, and hundreds of other conditions. The vast majority of people out there, both children and adults, have no diagnosis. They don't know that they have it yet.
Once diagnosed, Beth learned that if she monitored Gwynnie's blood sugar levels, along with specific treatments and diet, she could keep Gwynnie healthy and out of the ER.
If we had the test, it was available then, and she had gotten it, it would have prevented the near-death situation that we found ourselves in.
And now getting information out about this little-known disease is now a major goal for Beth.